This is Dr. Jason Shumard with Integrative Wellness Center of San Diego and also the author of The Thyroid Epidemic. And today I have a very important topic, one of the most common things that I talk about in regards to our thyroid patients in our office, and that is autoimmune disease. You know, many people that are dealing with a thyroid condition don't even realize that their main underlying cause is typically an autoimmune disease, where the immune system is attacking and destroying and killing the thyroid, creating a condition called Hashimoto's or creating a condition called Graves' disease. Now, the statistics tell us about 90 to 95% of all thyroid cases are due to this autoimmune disease. And so, in many times in the traditional model, there's not a lot of analysis, there's not a lot of treatment options, because there's really nothing can be done through pharmaceuticals, which is typically going to be the treatment of choice in the traditional model. The good news is there's lots of things that can be done in the functional medicine or the functional health model, which is what we're going to talk about today. But the common question that I get is there a cure for autoimmune disease? Well, the easiest and shortest answer is no. There's no cure for autoimmune disease because your immune system in this specific case is doing exactly what it's supposed to be doing. See, the immune system's job is to find foreign bodies, foreign objects, bacteria, viruses, environmental factors, chemicals, things that are not good for your body. It's supposed to attack that specific molecule, destroy it, and then create what's called an antibody or a B cell or a memory cell to remind itself of future problems in the future. So in this specific situation, when you're dealing with an autoimmune disease, your immune system's been triggered or created to start attacking your own body. So in this scenario, we'll talk about the thyroid. The immune system's been triggered to start attacking your thyroid. So eventually over time, when enough tissue's been destroyed, the symptoms start to arise and you don't feel good. And so many cases what'll happen is they'll give you a hormone to replace the ability of your thyroid to produce its hormone any longer because it's been destroyed. And now your thyroid on paper looks better, but you don't feel better. And the reason why you don't feel better is because the immune system continues to attack and attack and attack until it gets worse. So you start developing maybe nodules, the risk of thyroid cancer, destruction of the thyroid gets worse over time, and maybe a thyroid removal may be required. Or if it's in the opposite state, Graves, hyperthyroid scenario, maybe you need potassium iodide or something like that. But these are all just treatments of the symptoms and not addressing the cause, which in this specific scenario is the autoimmune, the immune system attacking the thyroid. Now, on top of that, the other things that can be very scary is as the immune system is attacking your thyroid, it starts to attack other areas of your body. So it can start to attack the joints, for example, increasing the risk of rheumatoid arthritis. It can attack your nervous system, increasing the chance of MS. It can attack multiple areas of your body, increasing the chance of fibromyalgia. It can attack your skin, creating psoriatic arthritis, your pancreas, type 1 diabetes, and on and on and on. There's a diagnosis for every single tissue. So the tissue or the diagnosis is irrelevant because it's the immune system that's the underlying cause. Now the question is, if there's no cure for autoimmune, what can be done? Well, unfortunately, in the traditional model, the treatment is typically pharmaceuticals, and that's going to be steroids, immune suppressors, and if you've ever known somebody who's been on those types of medications or who's been around them, it creates a lot of health issues, a lot of problems from long-term usages, and unfortunately, it's just not the best option. So in a functional model or functional health model, what we're going to look at are, number one, what are the areas in the body that are not functioning optimally that could be triggering the immune system to attack your body? But also, what other triggers are there out there? Now, there's three triggers that I want to talk about first that are common, what I refer to as primary triggers. So these are ones that potentially could have started the rolling out of that immune system attacking your body. So the first one can be hormone surges. So because thyroid conditions typically affect women, it can affect men, but mostly women. And a female's life, there's going to be 3 times in their life where they're going to have these hormone surges. The first one is the start of menses. So we have that hormone surge at the start of menses. The second one is going to be childbirth. And this can be first, second, third childbirth. It doesn't have to be the first one to the last one. And the last one is going to be menopause. These are going to be the 3 most common types of surges that happen, of hormonally speaking, in a female's body. And these hormone surges can trigger the immune system to start the attacks on the body. And that can be anywhere in the body, but in this specific scenario, we're talking about the thyroid. Now, the second one, that's going to be a common type of initial primary attack, is going to be genetics. Obviously, we know that genetics can play a major role, and they increase the risk of predisposing the individual to having autoimmune attacks. Let's say mom had rheumatoid arthritis, or dad had psoriatic arthritis, or there's other autoimmune problems in the family. It's going to increase the risks. But the cool thing is that we can manipulate the genetics with something called epigenetics. And what epigenetics do is they manipulate the way the genes express themselves through environmental factors, meaning lifestyle, diet, how the environment of the body is, and we can manipulate these genes that we can potentially suppress the way those genes are being expressed and stopping the risk factor for future attacks and creating more autoimmune problems in the body. Pretty cool stuff. The third one, that's the common one, we have hormone surges, we have genetics, and then we have something called leaky gut. Now, leaky gut, for those of you guys that don't know what this is essentially what happens is the environment inside your intestinal tract starts to get very disrupted, and the lining of the gut starts to thin. And as the thinning occurs, you start to get these microscopic holes in the gut lining, which now allows internal gut function to go into the external. So we can have, bacteria, undigested feces. We could have undigested food that starts to come through. And that's what I really want to talk about in this specific situation, because what happens is, due to leaky gut, you can start to create what are called food sensitivities. So I'm just going to label that FS, food sensitivities, because these macromolecules start to go through the gut lining into the immune system, or into the bloodstream. The immune system sees it, says that's not supposed to be there, starts attacking it, and next thing you know, you start to develop a sensitivity to that specific type of food. Other things that could happen with this could be like infection patterns can create leaky gut problems. We could see meds can create leaky gut problems. Foods, that's 2 O's. Foods, things like dairy, things like grains, things like gluten. These things can start to disrupt the gut function and start to increase the risk of leaky gut. So these sort of things can be primary reasons for someone developing an autoimmune condition, and they can all be addressed, by the way. They can all be addressed and to stabilize, to start to halt or arrest or slow down, in some cases potentially stop the attacks on the body. Now, other types of things that could happen within the body that can create these triggers. So let's label this triggers. We could see infection. We could see toxicities. As I mentioned, hormone surges. We could see blood sugar problems. We could see adrenal issues. And a whole slew of other problems, right? I could sit here and write probably another list of another 20 to 30 things that could be potential triggers to the immune system attacking the body. This is how we are different from a functional model, because we can address these things and it does not require pharmaceutical drugs. Whereas the traditional model, the treatment of choice, is typically going to be using pharmaceuticals, and a functional model, we're more of a lifestyle, holistic approach using food and dietary protocols nutrition, nutrients, nutraceuticals, supplements, herbals that can help the body restore function. And when you restore function, you then are able to stabilize the immune system, stopping additional attacks for the future. So this is a really cool stuff. So obviously you can't cure it, but there's a lot of things that you can do to arrest the attacks and allow the individual to live the quality of life they want to live again. So I know this video was a little bit longer than my regular videos, but I thought it was so massively important because it comes up so much in my talks with other individuals and practice members in the office in regards to thyroid condition. So remember, the first thing is number one, autoimmune disease, Hashimoto's and Graves are the two most common cause of a thyroid problem. So if you haven't been diagnosed with that, it's likely what your cause is right now and you're not being addressed appropriately, which is why you don't feel good. So hopefully that today's video was worth your time and you felt it was valuable. If you did, please comment below. Let me know if it was worth your time and it was good information. Also like our page so then next time I go live, you can be aware of that and you can join us live when we're doing this. And then lastly, if you have any specific questions or concerns, make sure you post them in the comments. If there's a video that you want me to do because there's a condition you're dealing with or you're not really sure of and you want me to focus on that, I'll be more than happy to do that as well. And if you're looking to schedule an appointment to talk about your specific case to see if autoimmune could be one of the issues you're dealing with and the cause of your thyroid condition and what can be done about that, we can sit down, you and I, and have a virtual conversation to see if what I do in the office may be appropriate for your needs and to see if we can help you like we've helped thousands of other patients with chronic diseases over the years. So lastly, I'll put one more plug out there. If you want to find out more about what I do and how I help patients, we have a YouTube page you can go and watch. It's Integrative Wellness Center of San Diego, or you can search my name, Jason Shumard, DC, and you can see other videos that I've done and also patient testimonials that we have on there as well to give more information